Hi, how are you? My name is George. I'm a treatment coordinator here at Radiance Dentistry. This is Dr. Mounir Iskandar, surgical prosthodontist. And we're here today to talk to you guys about All-on-4. All the questions that you need to be asking to when you're choosing a provider, for you to know what is All-on-4, what does the procedure entail, and whether you do your procedure here, or you're investigating or trying to find out if this is the right procedure for you. We want you to know what are the right questions to ask. What should you be asking about your dental provider? So we'll be answering any questions. So please comment on the chat. At the end, we'll answer any questions that you guys may have. Let us know where you're joining from. We'd like to know where you guys are joining from. And so make sure that you ask any questions that you may have. Okay, so I'll start talking a little bit about us. So Radiance Dentistry is, we are located in Irving, Texas, which is a suburb of Dallas. We're about 10 minutes away from DFW Airport. We are in a 9,000 square foot facility where we do all of our surgeries. Also house a state-of-the-art dental lab where we fabricate and design every single appliance that is delivered to our patients. We also have outside customers in the labs. This is a national lab. In addition, we also have a Dental Implant Institute where our doctors teach other doctors how to do advanced dental implant procedures. So we love for you to visit, and we hope to see you here soon. Okay, so the video that you're seeing on the screen is a little bit of a tour about that shows you our facility, some of our technology. We do have a full digital workflow. It's all state-of-the-art technology. We use the most advanced techniques and devices to perform our surgical procedures, from what's called guided navigation to 3D printing, computer-aided design. Every single arch, every single prosthetic is bespoke design for each individual patient, and is manufactured to fit. So without further ado, we'll get going with our presentation, and then we'll go back to Q&A with you guys. Okay? All right. So stick here. All right. So what is All-on-4, Dr. Iskandar?
Okay. First, hello everybody. Glad to be with you today and answer any question you might have. So let's start first with what is All-on-4. All-on-4, basically, it's the brand name of the procedure. It's not exactly how we do it, because typically we call it All-on-X. X, no matter how many implants we need to make this procedure. It's basically a full arch, I would say arch, full bridge that we do it on 4 implants, 5 implants, 6 implants, sometimes 8 implants. It depends of every patient's need. So it's not just 4 just the name of the procedure. And when we say arch means either the upper jaw or the lower jaw. And typically that's what we'll need. I don't personally like placing only 4. It doesn't give us enough spread for the entire jaw. So that's why I always try to make at least 6 to be able to make the teeth all the way to the back to give the full smile and the full functionality. Having teeth hanging in the back without support is not something engineering good. So it's always better to put more implants, not just for the spread. The more implant we have is the more foundation we have. So imagine that you have like 1 ton. 4 men carry it versus 6 men carry it or more. If something wrong to happen to any of these implants, the more you have, the more secured you are. And that's why we always try to make All-on-6 if possible, but the All-on-4 comes from the name of the procedure.
Yeah. It's something else that it's important for people to understand. This is a fixed restoration, so it's not something that comes in and out.
It's something fixed, and it should replicate exactly your teeth size on top of what we call it, the ridge. So the teeth should come out of where your original teeth were already positioned before. So placing the implants always is a key factor of, we have to plan it in a way that the teeth are strictly placed on the ridge. There is not too much gum or not too much thickness of the prosthesis. And that's why there's something, it's very important to understand when we call it prosthetically driven. Prosthetically driven, it means that first we have the mouth, we have the teeth exactly where you born, like naturally, and then we have to place the implant in a certain position so the teeth will go exactly on top of it. Failing to plan this particular piece is a big problem because that might make it thick prosthesis. One of the famous problems with this, one patient saying, yeah, but my teeth is sick, affect pronunciation, and I cannot talk. If from the beginning the surgeon and the prosthodontist are sitting together designing the case, all this problem will be completely eliminated. Because first we have to design where the teeth should go. So it will not affect the thickness, will not affect the speech, it will not affect the look. Then we design it, the implant will be placed according to this look at the end. So we have to have this final look as a start, not at the end. A lot of problems sometimes in other places, for example, when the surgeon will go there day of the surgery to look on the x-ray and start placing the implants. I don't know how they do it, but in my opinion, I believe it's undoable. Because if you are not planning your implant exactly where it should go, knowing prior how the teeth will go, that will create a lot of problems down the road. And a lot of unhappy patients.
So when you talk about implant planning and the implant placement, how are you able to place them precisely where you want them to be?
So step one, of course, we have to get the CBCT scan to see exactly how the teeth look like. Then we take a lot of diagnostic records, facial pictures, intraoral scanning. We have to get all this designed prior to the surgery. Even before the surgery, we have to sit with the patient itself to review this final design. The patient needs to be happy about it. And then the final piece now will come to me, okay, now I have to put the implant in certain position. How I will go there? Doing this just freehand, throwing implants, I will not be able to do that. So it has to be some sort of guidance. I like the navigated guided compared to different way of guidance. I will not go so technical here, but the navigated guided give me the chance is to plan the implant where I want them to go, and then during the surgery I have the bone on a screen and placing the implant exactly where I want it to go. It's something like the laparoscopic surgeries. It's just like seeing the bone live as you go, pre-planned. Mm-hmm. Not sure if it's clear this way.
Yeah. So it's a device where, and I've seen it in action. I've seen him doing it, and it's very neat because he can actually see the bone and where the implant is and everything. So he can actually place the implant within a micron of where his initial plan is. So that goes back to what he was talking about, planning and have everything mapped out so you can have an ideal outcome at the end. So, okay, so let's move on to what questions should patients be asking one thing, loading the temporaries. So do they get the teeth same day, next day? What's the protocol?
Okay, it's some doctors wanted to do it the same day. I prefer to do it the second day. The reason why I prefer to do it the second day for many reasons. First of all, the day of the surgery, after we finish the surgery, the patient is so tired. Preparing this will take 2 to 3 hours. I prefer to take my records and the patient go home and sleep. Let's say that we did on the same day. Patient will not be able to feel or to give any feedback about the bite or anything from that nature. It's very important the patient now to be aware and feel the teeth so he can feel it as I place it. Just giving the patient this teeth, okay, go home now. I believe it's too much. It's already like long day for the patient and they have to go home. Plus, when we do this digitally, there is a process here. We have to take digital records. We have to apply this to the designer to make the final tweaking, to mill it and do it like overnight and finish it correctly. Our attempts, some patient got confused, think it's fine because it's very accurate, very beautiful, looks like the finals. Quality cannot be rushed.
Mm-hmm. Okay. Now, what about the soft diet? So they have to be on a soft diet. Why is it?
Implant during the healing phase, which is typically about 2 to 3 months, cannot be overloaded. Now there is something we call it bone integration with the implants. This is a process. The bone needs its time to fuse with the implant. During this time, the implant is very sensitive. We cannot overload it by heavy chewing. So even if I delivered a final the second day, still the patient must be on a soft diet for the following 2-3 months, for the sake of the implant, not for the sake of the actual bridge or prosthesis. Soft diet means anything that you cannot cut with plastic fork, you should not eat. Anything chewy or require too much forcing on the implant should be avoided for the following 2 to 3 months. So there is no benefit actually from having a final the second day. I don't see it.
Yeah. So I know there's some places out there that they do the final restoration within a week or a very short period of time. Is that advisable?
I will not do it. I will not do it. Because what if the patient didn't like what we planned? The first 24 hours when I delivered the first stem, although we sat with the patient prior to design this one, but everything this was on the screen, right? Mm-hmm. Didn't have the chance to see it, to feel it inside the mouth. How I can just like force the patient, okay, no, that's what you have, take it. No. Actually, we deliver 2 sets of tempers, one 24 hours and another one within a week. And the reason why I give one in 24 hours, just to confirm that all what we have planned, all what we designed on the screen is what I have. If this is the case, so within 1 week, I'm giving another set of temporary. We put much more reinforcement in it. Sometimes we put bar inside and the teeth. Not being temporary, it has to be plastic. No, it has to be strong enough to serve the patient for the next 2-3 months, not to break on them during the healing time, because this is very critical. Just piece of plastic as a temporary that I will tell the patient go 2 to 3 months, not safe. I always try to put another layer of protection.
Okay. What about once the implants are healed? Can the patient eat any food?
Yes.
Anything?
Yes.
Jump on ice?
Yes, but don't.
But they're able to eat any food.
The material is made out of zirconia. Zirconia is the hardest material on earth. But even with your natural teeth, you don't want really to overload that. Mm-hmm. I mean, just eat whatever you want, like enjoy it. It doesn't have to go back to the bad habit that you had before this one and do things like that. Mm-hmm. Okay, now you have a chance that you have new set of teeth, replacement for these that you're born with. So give yourself a chance to take care of them now.
Okay. Right. What is the maintenance like?
Maintenance like, of course, anything it must have maintenance. So in-home maintenance, you have to brush the teeth with ultra soft toothbrush, and I have to very stress on this one. The material is same like the China mark. It has sponges enough. You don't have to scrape it, because scraping it will scratch it, will make it easier to collect stains, right? So for this teeth, just ultra soft toothbrush, brush the teeth, brush around the gum to massage them. It's the connection between the teeth itself and the gums, and use water pick to clean underneath. This is the everyday work. Every 6 months, you still need to go to the hygienist to clean deeper around the abutments, which is the connection between the teeth and the implant, and to also make sure that we follow up with x-rays, make sure that the implant is in good shape, nothing wrong with them, because some places you just place it and you are on your own. Okay, what if in 6 months or 7 months or 1 year, one of the implant doesn't look right or something is going on? It's much better to interfere once we see it versus when the problem happens. So that's why we always having our patients come back every 6 months to check on them, take one CT scan every year to check on the implants, and this is how it should go. It's same routine of natural teeth, but do it for these bridges.
Okay. So, so the questions that a patient should be asking about their dental provider, right? So first of all, how much experience does my doctor have? Why is that important?
The more we do, the more we learn. Yes, we placed here I placed thousands of implants. I placed hundreds and hundreds of these bridges. Every day you learn. I will not be like ashamed to say, every day we learn. Every day is a new case. Every day is a new challenge. The more you do, the more you learn. And that's how it should go. Doing it once every month or twice a month or even 5 a month is not really enough for that. This procedure is very comprehensive. You need to learn about bone, about soft tissue, about so many things. So doing it once or twice of a month is not really enough for that. Having the oral surgeon and the prosthodontist working together in this procedure is very important. And that's what I mentioned even in the beginning. When the oral surgeon just showed up in the room the day of the surgery, let me see the x-ray. Where was the communication prior? This is important. So the place you go to, you need to make sure that the team is working together on your case before. This is very important. The lab in place. Not every time you have a problem, okay, let me send it to the lab and come back. If the lab is not in place, this is not practical, let's say it this way.
Okay, important. What about warranty? The warranties on the implants.
Okay, implant once it's placed should stay for life. Okay, things might happen, but if it's done correct from the beginning and we know what we are doing, implants should last for life, and that's why we give lifetime warranty on the implants. Okay, but even if I give a lifetime warranty and the patient didn't do their part, let's say this way, we are one team here, right? Me and the patient and the prosthesis. So we need to make sure that we are following everything needed to maintain it for the lifetime. By literature, by science, implant survival rate is about 98%, which is lifetime. Sometimes just 2%, but even if that happened, we take the responsibility to fix it. But always ask my patient, do me a favor, just follow the instructions and it will last for life, because it should last for life.
But still offering lifetime warranty, peace of mind.
Yes.
Okay, perfect. Okay. Do I have to do my treatment with separate providers? Is that advisable?
Back to the same point. It's teamwork, has to work together. Different providers, even if in 2 buildings next to each other, is not the same. It's not that. The whole team need to be on the same place. So wherever you want to go in a place, make sure that the team, or the entire team working on your teeth, is in this place.
Okay. What about the lab? Right? It's important to know if the provider has an in-house lab or if they send the work outside.
Yes, this is part of the process.
Why is it better to have it in-house?
Because any changes needed, for me, for example, I have full control on my cases. Everything I wanted, I just go to the lab and sit with my technician, change this, do that. It's very hard to do this one if the lab is somewhere else. So you have to have full control on the whole process.
Okay. What about anesthesia? What do you think?
The patient need to be sleeping.
Is it IV sedation?
IV sedation, patient has to be completely sleeping. This is a long procedure, 4 to 5 hours. Patient need to be completely relaxed, completely stable, no fighting, nothing. It's very technical, very sensitive procedure. The patient really need to be completely sleeping in this one. I don't really believe on the conscious sedation. Actually, it's very uncomfortable to the patient and to me. I want to focus on what I'm doing, so the patient need to be sleeping. And I prefer to have like medical anesthesiologists to take care of this piece for me. I want to focus in the patient mouth, and I have anesthesiologists with me taking care of the patient's vitals.
So it's a medical doctor, anesthesiologist that's taking care of making sure their lungs are okay, their heart's okay, everything.
Yes.
A medical professional that's prepared to.
I can't be monitoring the patient's vitals while I'm focusing on this one. It has to be dedicated doctor doing that.
Right.
Anesthesiologist,
Right.
not just nurse or something.
Right. Somebody that has a permit to do anesthesia versus somebody that is full blown.
Somebody can manage complication if it happens.
Which is the most important thing.
Yes.
Okay. So not cutting corners.
No kind of course.
Okay. All right. So another thing that is important to know, and it's very a lot of people it's an afterthought, and we believe that this is one of the most important things that you should be asking, because this is what's going to determine the durability and the aesthetics of your bridge, of your restoration, right? So we talked a lot about the implants themselves, but then when we talk about the restoration, it's a whole world, right? And so we want to talk about what are the different types of restoration, what are the differences of one versus the other. So you want to kind of take us from the...
So first of all, we have to make sure that the foundation is the same, in my opinion, no matter what we're gonna put on top. So surgery-wise, the concept of 4 to 6, the number of implants, the soft tissue management, this foundation, no matter what we're gonna do later on, has to be the same. The variable factor now is, okay, it depends on the finances, things, that, whatever. This is when we select the actual build. You can have a home, like decent home, premium finish, whatever, but the foundation need to be agreed
The same.
the same. Okay?
No matter what.
The question is, how durable is this prosthesis? So we go from, let's go from the top. Okay. The top for me, based on the latest technology, what we do here in our office, the hybrid zirconia. Hybrid zirconia is assembled in a way that we have zirconia on top, which is the teeth, has the maximum power of chewing, chip resistance, stain resistant, everything, you name it. And underneath this one, we put what we call it shock absorbent bar. It's material that it feels like our bone. So the clacking sound of the zirconia is kind of like shock, it's absorbed underneath that. So this material do act like shock absorbent for the sound, for the forces. When we bite hard on top of it, it will not transfer all these forces of the bite to the implant. There is something underneath that disseminates the forces out, the sound out. So this is the latest technology now. Of course, everything comes with its own cost, of course. So if we go a little bit lower, okay, we still have the zirconia. I'm not a big fan of the monolithic zirconia, which is zirconia as one piece. Zirconia as one piece has a lot of problems, which is not to mention the heavy weight and the clacking sound. It's very rigid, so when it's bite on the implant, implant gut every time you hit it, you hurt the implant. Imagine you are driving a car in the desert without suspension. You keep shaking. Versus if you have the suspension, which is this bar underneath, will take all this shock out. Zirconia is very brittle, so sometimes when you do this fixation screw inside, it can crack. So monolithic zirconia in general, I'm not a big fan of this one, and that's why I try always to avoid it I would go even with a titanium bar and acrylic on top versus going monolithic zirconia. I don't like it.
Okay. What about the acrylics, the PMMAs and...
Acrylic is an option, but it's temporary option. It's not something durable that I will, you asked me earlier, I'll eat anything? No, in this one you cannot eat anything. It's something nice for you to function, eat soft, not soft diet, nothing crunchy, nothing hard. It seems like denture teeth, right? But the denture teeth actually is, because dentures can last even longer than these ones. The reason why when we do fixed, only the muscles and all the forces you are using it to chew. So the wear of the acrylic is faster. Patients who are wearing dentures, they don't feel this one because they are not even biting as hard as they when they have implants.
Mm-hmm. Okay. And what happens in a consultation? So when somebody comes in, they come to see us, they're having an evaluation. By the way, we don't charge for a consultation. It's a complimentary consultation. What happens during that visit?
So it's very important in the consultation to look to the patient as a whole, not as a whole. Okay. So you have to look to the patient entirely, the face, the look, the cheek, the color, everything has to be assessed. I'm not just working on the mouth, I'm working on the face, right? So we have to take the CT scan to see what's underneath this face, what's inside this hole, to see the bone, to see the teeth. We sit with the patient and to see what will be the best surgical approach. When I say the best surgical approach, because it's not cookie cutter. It's not you come to me, I will shovel the bone and then I'll just put the implant and then no, I have to evaluate. Is the patient coming consultation because he has completely severed bone resorption or something? The prosthesis here is different. Mm-hmm. Patient has good bone, but the teeth are in bad shape. Approach here is different. So this one, for example, we have to discuss the patient. Will it be what we call it FP1? This is the dental terminology. Like bridge and crown bridge style, when we pull the teeth and place implants right there, so it will be exactly the same, no cutting. Or patient have completely deteriorated bone, so now we have different approach. We have to go with different implant placement, and so each one of them is different. So this is the assessment that we have to know. And know it day of the consultation, by the way. Not later on, not day of the surgery. No, it's day of the consultation.
Mm-hmm. Mm-hmm. Okay. What about, so you do a preliminary surgical plan whenever you do the...
Before I go to the room, I have to go to the CT scan first to evaluate the bone, make sure that I have what I need. So when I go to the patient, when I promise something, I know what I'm talking about. Mm-hmm. I'm not saying, okay, I will do it. What if I can't? What if it's not doable this way? I have to be very knowledgeable about the patient's mouth and bone before step inside the room.
Okay, so when you walk in there, you have a general idea of the path that you're going to take whenever you do the surgery.
Yes. Yeah.
Okay. All right. It is a part that falls a little bit on me, and whenever we talk about the logistics of what are the visits going to look like, what are the different steps. So part of the consultations, after you've talked to Dr. Iskandar and he explained everything, answer any questions that you may have, actually he'll give you a bridge that you can hold in your hand so you can see exactly what it looks like in real life. Then we'll sit down, talk about the logistics, what needs to happen, what are the different visits, answer any questions that you have. Then we start talking about pricing, right? These are the different options that you have, right? If you need to do any kind of financing, then we could do financing applications. We work with 4 or 5 different banks. These are banks that specifically work with patients that are financing dental procedures that are, larger full mouth restorations. And there's different options. There's different payment terms, and they all do soft credit checks. So whenever we sit down, we can check all of them, see what APR you get, what how the terms, how many months, all of that, and we're able to do that without affecting your credit, because you definitely don't want to go and start sending applications that are hard credit checks that then will result in your credit score being lower. So we make sure that every company that we work with does soft credit checks, so then you can evaluate the financing options in a way that doesn't affect your credit. So because you need to make an informed decision, and the more options that you have, the better decision that you can make. But you don't want that information to come to a cost where it's going to affect your credit score. Okay. Wanted to talk a little bit about the technology that's used here.
Before I go to the technology, before I even go to the actual surgery, I want to share some of the concerns that the patient always ask, and I hear it from a lot of consultation. Will it hurt? Okay. Let's have an agreement here. There is nothing in the dental world does not have is painless. Okay. Some discomfort will happen. So we need to make sure it's not painless, but it's very minimal discomfort, I would say. And this can be controlled, of course, with pain medication and a lot of things from that nature. But not just that. The pain usually, for as a human being, comes from trauma, like hit, right? Pulling teeth is different than extraction teeth.
Okay.
And let me pull the tooth is meaning that I'm getting out of the socket. I'm not making too much trauma trying to pull it out. Hear this horrible story that the dentist was sitting on my neck the other day and trying to pull. That what caused trauma, that what caused bruising, that what caused swelling. Pulling the tooth in a very conservative way, and because pulling a tooth for an implant also is different than pulling tooth just for extraction.
Okay.
You have to pull the tooth in a very conservative way to make sure that this bone is protected. Bone is very precious, we have to keep it. We just go there to shovel the tooth and break the bone around it. That's what will cause pain. That's what will cause bruising and swelling. So part of the question of do I have pain? I would say minimal pain. Do I have bruising and swelling? It will be minimal because again, extraction and the way we pull the teeth has to be very well done. And this is what makes a difference between oral surgeon to another.
Okay.
Like shovel bone cut or...
Right. So oral surgeon cuts.
No, I'm not oral surgeon. No, the way of pulling the teeth by an oral surgeon, by the surgeon, this is one of the determination of how much pain I will be getting and how much swelling or bruising I will be getting.
Okay.
Is the way of pulling the teeth.
Okay.
That's...
Okay. Other concerns that you hear from patients regularly?
Main concern always pain. Will I have pain? I just talked. Like if we done it right for the surgery, if we follow the instructions, no smoking after the surgery. The regular instructions, if it's followed correctly, should not.
Okay.
Should not.
You give them medication for the pain?
Medication for the pain, antibiotic, sometimes steroids for expected swelling. That's it.
Rinses
rinses. We have a list of prescriptions. We take the patient step by step. Some patients want to know the whole story from the beginning. Yes, we say, but we prefer to give the patient as we go. Instructions of today's surgery will be different than tomorrow when I see them. In 1 week, I will give another set of instructions. In 3 weeks, I will give another set of instructions. Each stage has its own instructions, so we don't really overload them. As far as we are doing that, it should not, no pain or least discomfort.
Okay.
Yes.
Okay, good. All right. Okay. So let's move on to technology.
Okay.
So that's one of the things that we're very proud of here at Radiance, where we use and actually have developed a lot of technology to make things better, more efficient, at the end of the day, better patient care. So you want to talk about
It's now we are in the world of the digital world. Everything we do it digitally. Everything we design digitally. Even the surgery itself is kind of digitally planned and performed. The old school of having impression and this goofy stuff in the mouth and try in on a piece of wax, it's not really pleasant. So everything here we do it digitally. I'm not sure how far I can go with this kind of digital world, but these days are totally different. I would say in the past 5 years, it was kind of like mutation in the implant dentistry, especially in this one. Whoever falling behind and not following the digital, they are losing a lot and their patients are losing a lot too.
Okay, so GUI impressions?
No
more?
We don't use the same thing anymore.
Okay, so what about like now you 3D print them?
Either 3D printed or milled. Both. It's very technical about these things about print versus milled. Printing is more of try-ins, milled for more of permanent restorations, but everything is digital.
So it's all designed on the computer. It's all
either milled or printed or what, but everything is
right. And that brings us to the smile design appointment and,
yes.
and part of what you do with that. So could you talk a little bit about what that is?
So when we design it digitally, the patient will sit next to me. Okay, I want this to be a little bit twisted, shifted. We do all this on the screen. The patient will be able to visually see how we put the face and the teeth behind it, and we do the design. The patient will see exactly what his wish list, his dream smile. He designed it with me, or she designed it with me. So I can do this one on wax and thing, how the patient will visually get it.
Right.
We have to design this prior.
So they'll be able to sit in front of a computer screen, see their own face, a photo of themselves, with the teeth, how they're gonna, and then they can say, hey, can it be a little longer, a little shorter, a little wider, a little rounder, a little square?
Exactly.
Yeah. That's very neat. Very neat. Okay. All right. So we wanted to showcase some of our work. We have some photos. So we'll scroll through them. So before and afters. It's just a lot of our patients, and we're very, very grateful that we have some great patients that have, they want to share their stories, they want to share their smiles and, where they came from, where they got to. It's very fulfilling for us as we are, going through what we do, and just to have those happy days when people see their new smile, and it's very fulfilling. So you can see that. We'll turn over to the Q&A session of this. So I don't know if there's anything else that you want to mention before we start answering questions from the chat. Anything you want? Okay, so let's take a look. Let's take a look here. See. Where are you located? We're in Irving, Texas. Let's see. So we have people from Kemp, Texas, Louisiana, Kemp, Texas, Portland, Oregon, Gainesville, Texas, Duncan, Oklahoma, Fort Worth. How are you guys doing? Are you limited to what kind of foods you can eat after, like chips, apples, etc.?
Yes, after the surgery, yes. But after the final, leave the office to the steakhouse.
Okay, let's see. Let me see. Nobody else on the line. Is somebody's asking, is the surgery done in one day?
Yes, the surgery in one day. But as I mentioned, it's process. It's visits and yes, the surgery in one day.
Okay, perfect. How much is a down payment for a full set? Depending on the financing that you do, most of the plans do not require a down payment for financing. It all depends on your credit score. That's how this world works with financing. So people that have a more favorable credit score, they'll be able to finance the whole thing without a down payment. Some people do have to give a down payment. It's actually required by the financing company. But the majority of people, when they do the financing, they're able to do it without any down payment. And we do work with companies that work with people that may not have a perfect credit score, what's called subprime. So even if you don't have a perfect credit score, if you have, they talk about 600 and up, 650 probably is more of your sweet spot. But that's the ballpark, the credit score that they like to see to do financing. Let's see, does insurance cover like TRICARE, Medicare, Medicare Advantage? So generally speaking, insurance does not cover a procedure like this. Generally speaking, there are some plans out there that do cover. Blue Cross Blue Shield Medical covers it, is likely to cover it. Other medical insurances do not. Dental insurances do cover this, generally speaking. However, dental insurances usually give you a very small amount towards dental work every year. So while it does cover it, it doesn't cover much of it. So generally speaking, patients pay out of pocket for a procedure like this. I need upper and lower. I have no teeth that were pulled. I have a lot of bone. Do you have programs? And I saw somebody asking about grants. The state of Texas does have a victims grant. Generally speaking, whenever you see advertisements on the internet about dental grants, they're more of a marketing way to get you to click on something. The reality of it, the true reality of it, is that this is a procedure that you pay for out of pocket and you do financing for. Okay, let me see. I'm reading through the questions. What is the total price of all of this? It depends. It depends on every patient. So whenever we do the consultation, we'll give you and what we do is that we give you a price that is all inclusive. We're not gonna piecemeal anything. We'll give you one price and that's it. It's all in. And it includes everything. We'll give you different options and then you choose whatever you want. Our prices start from $16,500, go up depending on the restoration that you choose. But that's ballpark what that is. Depending on some people want to know what the monthly payment is. It depends. It depends on your credit score. I had somebody that did financing last week and her payment was under $250 for one arch. She had good credit. She did the financing. Then it goes up for there. If you do some down payment, that helps bring your monthly payment down. But generally speaking, it can be fairly accessible. Okay. Do we take Medicare, Medicaid? Medicare, generally speaking, do not cover this. And you can call right now. We have our staff standing by. If you want to call, you want to have some answers to your questions specifically, the number below, 469-294-8645. We have people on standby. If you want to call, please give us a call. Also, if you want to see if you qualify, you can click on the pinned comment. There's a link for a quiz. You can give us information. We can reach out to you. But if you want to call, we have people standing by that could talk to you and answer any questions that you may have. Okay. Let me see. Somebody was asking about Medicare, Medicaid. Generally speaking, they do not cover this. Let me see. Do we take Blue Cross? We do. Do you take Aetna? We do. We take all PPO dental plans. HMOs, we're not an HMO provider. Generally speaking, they don't cover this. So if you have an HMO, change to a PPO. Okay. Can we use insurance first and pay for the rest of installments? Yes, that's what people generally speaking do. They use their insurance and they finance everything in installments. Do we take Cigna? Yes. Let me see. asking if we take glucose. Yes, we do. Would you rather put the implant where the molar had pulled out so the patient face cheeks do not look like they're missing a molar?
What was it?
So the question is, would you place the implant where the molar used to be so the patient face, their cheeks don't look like they're missing teeth? How does that work?
We design it this way, yes.
Okay.
We-
So you design it so it looks like full supported.
That's exactly what I mentioned at the beginning. We put the teeth where it belongs originally, and then we place the implant and the prosthesis accordingly.
Okay, perfect. Let me see. Will the the implant bridge make your face look thinner because I had molars missing whenever they're collapsed? Will their face look a little longer?
This is part of the design. We looked at the patient as a whole.
Okay, all right. How many trips would I need to be made in order to complete the process?
I would say, to be honest, no less than 5 to 6 visits.
Okay. Okay.
Yeah.
All right.
If you wanted to do it right, as simple as that. If you want to do it right, this is 5 to 6 visits. You can't rush quality. You have to try it. You have to test it. The patient need to have the chance to have what we call it try-in or test drive. We put the teeth before final for the patient to feel it, to see it, to get feedback from friends. I don't believe that I would like to invest this amount of money for somebody to tell me, okay, here is in your mouth, go. No, I want to try it first. I guess this is the
So, in other words, somebody comes in, you discuss changes to their teeth, and you made them a new temporary with the new specifications.
yeah, try it.
You put them on, they tell you, I love them, go ahead and make me my finals now. What do you tell them? Go home, try them for a couple of weeks,
Sometimes I do.
make sure you love them.
Make sure you love them. Make sure your wife or your girlfriend or whatever say give me a thumbs up before you say so. I mean,
Yeah.
sometimes the challenge is not the patient.
Yeah. So you want people to be really happy with
Happy,
that.
yes.
Yeah, okay. Perfect. Okay. Let me see. Chris Jackson, see you on the 23rd for my procedure. Hi, Chris Jackson. Let me see. How do I get third-party insurance? Do not get third-party insurance. There's not a single policy out there that's worth it that you can buy out of pocket. You're going to end up paying a lot of money and they won't cover this procedure or many procedures. So that's do not do that. Okay. What about bone loss? What if somebody has a lot of bone loss and they've been told that they can't get implants because they don't have enough bone? What happens?
We'll find it. So there are many, what we call it the pterygoid implant, the zygomatic implants, the many surgical procedures we can do for those patients. I would say 99 of the time there is a solution.
Okay.
So no matter how atrophic it is, there is always a solution.
So even if somebody's been told before you're not a candidate for implants because there's not enough bone, 99% of the time
There is a solution.
you can do it. You'll find the bone.
Yeah, we'll find out, yes.
Okay. All right. Let's see. I'm reading through the questions. Thank you, everybody. There's a lot of questions here. If I have too many, if I have to have many teeth removed, is it still a one-day procedure?
Yes, it has to be 1 day. Because we have to finish everything and place the implant to deliver the teeth. So it has to be, yes, all 1 day, no matter what.
Okay. All right. Am I sleep during the process?
Deep sleeping, please, yes. Of course.
So they come in, you say, see you later. When they wake up, it's all done.
That's it.
Okay. 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 What about, I'm 56 years old. Can I still get implants?
You are still so young, by the way.
Very young.
Very young, yes.
Yeah. Yeah. It's generally speaking, the people getting these procedures are people in their 50s, late 40s, 50s, 60s.
From 40s above. So being in the 50s, this is kind of like
Very young.
Average age, yeah.
Yeah. Okay. Okay. Um, so, a man's disability. Will there be stitches?
Yeah. But it will dissolve by itself within a couple of weeks or so.
Okay. Do you guys do bone graft if it is necessary?
Included, sure.
Yes. So, okay. Um,
But here's the thing, bone grafting, also something technical. Bone graft is to fill the voids of after the extraction or something. Preferably not to put graft, to put implant inside it. In other words, the purpose of the graft is to reshape the ridge. But we need to find a native bone to put the implant. But yes, as far as like included, yes, included. Mm-hmm.
Okay, okay. And again, another reminder. There on the linked on the pinned comment, there's a link where you can fill out a survey, quick 20-second survey to see if you're a good candidate for this. So if somebody told me I don't have any bone at the top, would I still qualify? No bone.
Zygomatic at this point.
Okay, so there are special types of implants called zygomatic implants that go into zygomatic bone, which is right under the eye. So even when something has extreme bone loss, we still have procedures for that. So it's very, 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 very rare, almost non-existent when we say that it can. I've been around here for a few years. I've never seen you tell somebody we can't do it.
Never say never.
I know.
But
I haven't seen it.
Okay, but might happen. We are not the god of dentistry here. I mean,
The god of dentistry. Okay.
No.
Let me see. Are these permanent teeth that do not come out?
No, no.
They do not come out.
It's same like your original teeth. It's come out of your actual ridge.
Okay. This is a good one. I am a smoker. Would the implants work for me?
Better quit.
There's a lot of good reasons to quit.
Yes. You invest a lot in this one. Better quit.
What happens with smoking? Why is that harmful for the implants?
The heat of the smoke, the nicotine, the gums, a lot of problems come with that.
Okay.
So better not. I would say success rate of implants in smokers less than the success rate of implant of non-smoker.
Non-smoker.
Yes.
Okay.
We consider like this is medical condition. Being smoker is medical condition that might affect implants success.
Okay. Okay. Let's see. How long after the procedure before I can eat solid foods?
After the implant heals, which
Okay.
is the 2-3 months.
Okay. Carla, sorry I skipped your question. If I'm SSI, can I get this done free being on Medicaid? No. They do not pay for this procedure. Okay. Let me see. What about swelling and bruising? You talked about it earlier. Maybe they missed the answer.
Swelling and bruising happens from the extraction of the teeth. So it has to be pulled, not extracted. The way of being conservative in pulling teeth is very important to avoid and bruising and swelling and pain.
Okay, perfect. My 2 front teeth are chipping bad. What's the price, give or take, to fix them? Don't have any insurance. Can you please help me? Hard to talk about the pricing, but because it depends on what you need, and it's hard to guess. Do you need a couple of crowns? Do you need implants? So the range it's quite big. But you can call us, book an appointment. We'll be glad to take a look at it, and then once we know what needs to be done, we'll be we can give you a more precise idea. Okay. Somebody asked, what does the diet look like during the 3 months? So we talked about soft food diet and
anything you cannot cut with plastic fork, do not eat. Preferably not. Nothing chewy.
And it sounds awful, but all the yummy carby foods, are included there. So pasta, rice, ice cream,
Cheesecake, yeah.
cheesecake,
Now
cake.
there's no decay anymore, so it's fine.
Yeah, no, you don't have to worry about cavities, so you can eat all the sweets, nice soft sweets. You can eat, you know, of course, soups, all manner of soups, bread, so cheese. So as long as it's not hard, you can eat it. So you can eat a very healthy diet and also not so healthy, a lot of carbohydrates. But it's not a horrible diet. What you have to stay away from is very crunchy salads or steak. You know, anything where, like Dr. Iskandar said, if you can't cut it with a plastic fork, you cannot eat it. But it's not a horrible diet. Okay. Being on a fixed income, I cannot receive free. No, unfortunately, it's not covered. If I'm ready to move forward, you just call to schedule. Yes. Please call the number that we have on the screen. We'll be happy to set up an appointment for you to come in and come in for your consultation and just start the process. We'd love to have you. So please call. Click on the link on the pinned comment. Also, follow our YouTube channel. We try to put out content for you guys every so often, so you can see what we're doing. We're going to start doing these webinars frequently, so we can keep on answering questions that people may have. So make sure that you hit the subscribe button and hit the little notification bell, so you can know when we're doing this. Somebody else asked a question, start to finish, how long does the entire process take, the entire procedure take?
The actual surgery?
It says procedure, so I would imagine they're asking.
If it's the procedure itself, 4 to 5 hours. If the entire thing is 4 to 5 months. 4 to 5 months.
So the surgery itself, 4 to 5 hours. The whole thing, 4 to 5 months. But they get teeth the next day.
Yeah.
So, okay, all right. That's pretty much all the questions. So. Thank you, Dr. Iskandar. You know, I think it was very informative. If you guys, again, if you have any more questions, feel free to call the number on the screen. Make an appointment with us. We'd love to meet you in person. This is what we do, and thank you. We love to do it, and this is a passion to us. We're passionate about what we do. We're passionate about helping people. Our favorite day is when a patient sees the new smile. It's very emotional for all of us. We really enjoy that part. So thank you for your time. Thank you, everybody, and hope to see you here soon. Thank you.
Thank you.